Hello everyone, in this video we're going to be looking at the Infratemporal and Pterygopalatine Fossa chapter of the course pack. This resource is brought to you by the Scrubs team, which is the Student Collaborative Resources for Understanding and Brody Success. My name is Bryce Pugh, I'm in the class of 2027, and this is going to be using some resources from the course pack illustration supplement. So first I'll quickly go through the mission statement. Scrubs is a student-driven initiative that aims to develop supplemental resources for current and future cohorts that will pass through Brody. Members of Scrubs participate in a variety of subcommittees working to create resources for students by students. These resources aim to offer a unique perspective from students that have walked in the same shoes, developing resources that we wish we had been exposed to during our time in the course. The hope is that this organization will become a staple of the Brody student body, exemplifying the unique collaborative community that Brody offers. If this is a mission that aligns with your goals and you have the desire to help those that will come behind you, as well as a goal to leave your mark on Brody as a whole, we invite you to join the team. And with this video, I want to have a disclaimer. The resources that are included in this document are made by students, not the faculty. As such, there's a possibility for error in our development, although it's mitigated via team to approach development with multiple stages of vetting. If there is a contradiction with the coursework presented within your course, please go by the course documents. Additionally, Scrubs aims to supply supplemental resources. However, these are in no way a replacement to the instruction of the Brody faculty. Use these resources as a supplement, but not as your primary source for the course material. So first we're going to be looking at the infratemporal fossa, and later we'll look at the pterygopalatine fossa. But the infratemporal fossa, you can kind of see, I put these pictures here just to show you like what the actual region we're looking at is. And so in both of these pictures, they're sticking their finger in the pterygopalatine fossa, in the infratemporal fossa. So you can go behind the zygomatic arch here, or behind the mandible, and those are both going to the region that we're going to be looking at. And so first we'll start with some osteology. And I also want to point out that because in this video we're looking at kind of a region, we're going to see a lot of familiar nerves and muscles and stuff that we've already looked at before. So this video might go over some topics a little fast, but if any of the points confuse you, go to the video that goes into more depth of that topic. And so with the bone structures that we're looking at here, the most important ones that we're going to be around is the mandible, the temporal bone, the sphenoid bone, and the maxilla. With the mandible, we can look up here in blue. The important things that we want to look at is the ramus, which is going to be this, like the flat wall of it here. And then we also have the angle, which is going to be this corner of it. We have the coronoid process, which is going to be this one up here. And then we have the neck, which is over here. On the temporal bone, we're going to have the mastoid process, which is going to be this hard bone that if you feel behind your ear, you can feel your mastoid process. And then we also have the styloid process, which is going to be the pillar-like bone coming down here below your ear. On the sphenoid bone, we're going to be looking at the infratemporal crest, which we can see here. And in this picture, the mandible and zygomatic arch have been removed. And so here's our infratemporal crest, and then also the pterygoid process, which we're going to specifically look at the lateral plate of the pterygoid process, which is down here. With our maxilla, remember that's the bone over here, we're going to be looking at the tuberosity of the maxilla, which is going to be down in this region. And so another view of the skull, here we've had the mandible and lower jaw removed, and so the course pack describes the infratemporal fossa as like a cube. That's kind of helpful, but it's not entirely accurate. So we're kind of going to be looking at this region here, as we saw that the finger was sticking into. And so first we'll go over the boundaries just to get an idea of what region we're actually in. And so the most lateral boundary is going to be the ramus of the mandible. And so the mandible's been removed in that picture, but here we can see we're going to go behind the mandible. And so the most lateral wall is going to be the ramus of the mandible. Most medially, we're going to have the lateral plate of the pterygoid process that we looked at, which was down here. Anteriorly, so moving anterior, we're going to have the posterior maxilla. Posteriorly, back here, we're going to have our tympanic plate and the mastoid and styloid processes. So that's going to be kind of down in this region. Superiorly, so going into the screen, we're going to have our infratemporal crest, the adjacent foramen, ovale, and spinosum, which would be kind of around here. Inferiorly, so coming out of the screen, is not pictured here. It's going to be a muscle. It's going to be the medial pterygoid muscle. And we'll look at all these in a little more depth, but this is going to give you kind of a region. And this can be a lot. I wouldn't go about trying to necessarily just memorize all of this. Just kind of think about what region you're in. And so if you're thinking about doing this in your head, you can imagine most laterally, we're going to have the ramus of the mandible. If you stick your finger as far anteriorly as you can, you're going to hit the maxilla. So that makes sense. That'll be the anterior border and stuff like that. So kind of try and think about where we're actually at instead of just memorizing. Now let's look at the contents of the infratemporal fossa. So what's actually in here? Here's a quick sketch that I've drawn just to kind of give you an idea of what we're at. But again, the cube isn't the best representation of it. And so the course pack kind of breaks it down into 7 contents, which is a little bit of an oversimplification, but yeah, so we have 3 muscles, an arterial structure, a venous structure, and kind of 2 nerve structures. There are a little bit more branches, but we'll look at that when we get there. So the muscles, it's going to be 3 out of the 4 muscles of mastication. So that's going to be our inferior part of our temporalis muscle, and then our medial and lateral pterygoid. The 4th muscle of mastication, remember, is the masseter. And thinking about the skull, that's going to sit lateral or superficial to the mandible. So if the ramus of our mandible is our most lateral position, it makes sense that the masseter is not going to be included in the infratemporal fossa. Arterially, we're going to have the maxillary artery coming off, which we'll look at that more, but it's going to be one of the terminal branches of the external carotid artery, and it's going to give off a bunch of branches in this region. We also are going to have one venous structure, which is going to be the pterygoid venous plexus. And again, we're going to look at all of these in more depth, but that's just going to be a venous plexus that's associated with some other regions and sinuses. And then finally, we'll have kind of 2 nerve structures, which are going to be the otic ganglion that we've talked about and the mandibular nerve. So that's V3, and most of its branches are going to be in the infratemporal fossa. All right, so we've already kind of looked at these in previous videos, but I'm briefly going to go over the muscles of mastication because they're pretty relevant to where we're looking. And so remember, all of these are going to come from V3, the mandibular nerve of the trigeminal. And so we have our lateral and medial pterygoid, our masseter, and our temporalis. So our lateral pterygoid, that's going to be pictured here. It's going to be the more transverse one. Our medial pterygoid is going to be running superior and inferior. And so briefly to go through these, our lateral pterygoid is going to have 2 heads, and it's going to originate from the infratemporal crest and the lateral surface of the lateral pterygoid plate. It's going to insert on the mandibular neck and temporomandibular joint capsule. And so you can imagine, originate here, insert here. If we're pulling back, then acting together on both sides, it's going to protrude the mandible forward. If we act alone, so just one muscle at a time, then it's going to move the muscle out to the side. And if you do it alternating from side to side. Next, we have our medial pterygoid going up and down. It's going to originate at the medial surface of the lateral pterygoid plate, so up here, in the tuberosity of the maxilla. So again, we have 2 heads with this, or 2 muscle bellies. And so we're going to insert down here together at the medial surface of the ramus. And so thinking about originating here, inserting here, if we're pulling up, all muscles do is pull. If we're pulling up, then acting together on both sides, it's going to elevate and protrude the mandible. Acting alternating, one either side, then we're going to produce a grinding motion, kind of grinding your jaw back and forth. And that's going to function with the lateral pterygoid. Our masseter muscle, which is going to be up here, and we can see here that it's superficial to the ramus of the mandible. It's going to originate at the zygomatic arch here, and it's going to insert on the lateral surface of the mandibular ramus and angle. And so if we're originating up here, or inserting down here, if we contract, we're going to elevate, protrude, and retract the mandible. So that one's unique to the masseter in regard to these 2. What's also going to help with that is our temporalis muscle up here. And so it's going to originate in the temporal fossa and the covering fascia, so all around here. it's going to insert on the coronoid process of the mandible. So that's pictured down here. If we remove the zygomatic arch, you can see it inserting here. And so if that muscle pulls, then you can see that the function is going to be to elevate and retract the mandible. One thing I wanted to point out here is that the medial pterygoid, so right here, and the masseter essentially form mirror images of each other. Just one is, the medial pterygoid is deep to the mandible and the masseter is superficial. And so now let's look at the maxillary artery, which was, remember, one of the contents of the infratemporal fossa. And so we talked about, we have our external carotid artery coming off, and it's going to give off our two terminal branches. That's going to be the superficial temporal, which is going to continue up, and our maxillary artery, which is going to travel into the infratemporal fossa. And so the way it's going to enter is by traveling posterior to the neck of the mandible. So it's going to travel behind the neck of the mandible, and then travel through here, and it's eventually going to go into the Pterygopalatine Fossa. And so, as we'll see, or as we have seen, is a common trend with arteries that have a lot of branches. We're going to group them off into 3 sections just to make it easier to talk about and think about. And so those sections are divided by the lateral pterygoid muscle. So we can see the boundaries of that kind of represent this one, this one, and this one. And so the most lateral one is going to be our first section, which is right where we're running behind the mandible. The second one is our middle section, and the third one is most medial or deep. And so here are the names of those. In the 2027 course pack, it doesn't have us required to remember these names, so you can just remember first is most lateral, third is most medial. And so let's look at each part and what the branches are. So the first part, which is going to be running behind the mandible, it's going to give off branches that are going to enter foramen and fissures. So we can see those drawn here. We're going to give off our middle meningeal artery, which we've seen before, and our inferior alveolar. And so a lot of stuff we're going to see is going to sound familiar because we also have some nerves that we've looked at that are going to run with these. But our middle meningeal artery, it's going to pass between the 2 roots of the auriculotemporal nerve, and it's going to travel through the foramen spinosum with the spinous nerve. And so those are both on V3, and what it's going to supply is dura. And so this drawing in red are the arteries, and in blue are nerves that are going to run with it. So remember, we're going to have auriculotemporal is going to wrap around the middle meningeal and run with the spinous nerve through the foramen spinosum. We also have our inferior alveolar coming off here, which is going to pass through the mandibular foramen and supply the lower jaw and teeth. And running with that is going to be the inferior alveolar nerve and eventually the mental nerve. So we can see that's coming off here. The mental is going to come off the mental foramen. And so you can kind of trace these as we go through one here. Next, let's look at the second part. So that's going to be the yellow part here, or between these orange sections. And so these are going to give off muscular branches that are going to go to the muscles of mastication, as well as the buccinator. So we're going to have a masseteric, which you can imagine goes to the masseter, a deep temporal, which would go to the temporal or the temporalis muscle, a pterygoid, which is going to go to the medial and lateral pterygoid, and a buccal branch, which is going to go to the buccinator, as well as cheek mucosa, because remember, that's really deep in your cheeks. And then our third part, it looks a little more complicated just because we have more foramen and a lot of stuff running with it, but it's going to give off branches that are going to enter bony canals and foramina, and it's usually going to be accompanied by V2 branches. And so we'll see this in a little bit, but this is kind of entering into the, Pterygopalatine Fossa. And so in the Pterygopalatine Fossa, we're going to be looking at V2. Outside of it, in the infratemporal fossa, we're going to have a lot of V3. And so when we're in here, it's going to be running with a lot of branches of V2. And so we can see this separation here is where we're going to have our 4 main branches. So we're going to have our posterior superior alveolar, which is going to run up here, and that can be seen up here. It's going to supply the upper jaw and teeth. And remember, the superior alveolar nerves are part of the dental plexus, so it's going to be with the posterior superior alveolar. We also have our infraorbital, which is going to run down here. It's going to pass through the infraorbital fissure and canal and come out onto the face. So remember, the infraorbital canal is going to be coming out on our maxillary bone up here. And so it's going to run with the dental plexus, zygomatic, and infraorbital nerve. We solved that with V2. Next, we're going to look at our descending palatine artery. So that's going to come off, bifurcate into the greater and lesser palatine arteries. And then they're going to travel through a canal of the same name, so greater palatine canal or lesser palatine canal. And it's going to supply the hard and soft palate, which is, remember, kind of in the roof of your mouth. And then running with those, we're going to have our greater and lesser palatine nerves. So those are all kind of named the same name. Finally, we have our sphenopalatine artery, which is going to come off here. It's going to pass through the sphenopalatine fossa, so again, named the same thing. And it's going to supply the lateral nasal wall and the nasal septum. The nerves that are going to run with this is the nasociliary nerve and the posterior superior lateral nasal nerve. Now let's look at the pterygoid venous plexus. So we looked at the arteries, now let's look at the veins that are in the infratemporal fossa. And so we've seen this before when looking at the sinuses and some of the veins in here. So we have our cavernous sinus here. Inferior to that, we're going to be looking at the pterygoid venous plexus. And so what this is a valveless plexiform venous network. It's going to be formed by maxillary veins. So those get kind of cut off, but it's formed by maxillary veins. And it's going to surround the lateral pterygoid muscle. It communicates with the cavernous sinus, you can see up here, the inferior ophthalmic vein, and the facial vein. And so we'll look back into this with clinical correlations, but you should have an idea. We've seen in a lot of other situations when we're looking at the cavernous sinus and sinuses, there's a lot of travel of infection can occur here. So we'll look at that in the clinical correlations. Next, let's look at the mandibular nerve. So that's V3, the trigeminal nerve, in the infratemporal fossa. So we mentioned that V3 is kind of the main nerve of our infratemporal fossa, and a lot of its branches and content come out here. And so we should be familiar with all of its branches and stuff pretty well. If any of this looks unfamiliar, go back and watch that video. But it's going to give off branchiomotor and sensory innervation in branches. And so branchiomotor, remember we're going to do our 4 muscles of mastication. We're going to go to the mylohyoid, the anterior belly of the digastric, tensor tympani, and tensor villi palatini. Sensory branches that we're going to give off, we're going to have our auriculotemporal nerve. We're going to have the inferior alveolar nerve, which that's going to run down here. And I wanted to point that out here because that's another clinical correlation we're going to look at, because it's going to come down and go to the teeth. We also have our lingual nerve and our buccal nerve. Also found in this region, we have our otic ganglion, which is on the medial side of V3. Okay, now let's move on to the Pterygopalatine Fossa. And so the Pterygopalatine Fossa is located deep on the medial wall of the infratemporal fossa. And so we can see here, this is kind of outlining the pterygomaxillary fissure that is going to be the opening into the Pterygopalatine Fossa. So we recognize all over here, we're in the infratemporal fossa, and on the deep medial wall, we're going to have a pterygomaxillary fissure that's going to travel into the Pterygopalatine Fossa. And so here's kind of a quick sketch to give you a better idea of it, but first we'll look at our boundaries and then we'll move on to what's actually located here. So this is kind of like a tubular, like pyramidal structure, and we're going to have a superior and posterior border is going to be our sphenoid bone and its pterygoid process. And then our anterior border is going to be the maxilla and palatine bone. And so you can see here, I've kind of tried to identify, like, this is going to be our anterior border, so palatine and maxilla bone, superior and posterior, that's going to kind of be back here, which will be our sphenoid bone and pterygoid process, which is also going to be the superior border. Medially, over here, we're going to have the perpendicular plate of the palatine bone, and then laterally, that's where we entered, so that's our pterygomaxillary fissure. Inferiorly, we're going to have the palatine canal. And so the palatine bone, if you stick your tongue up in the roof of your mouth, the hard part of your palate, that's the palatine bone. And so now let's look at what's actually in here. So we have a lot of different pathways and foramen, fissures, and stuff that things are going to pass through. And so first we'll look at the pathways, and then we'll look at what runs through them. So first we'll look at our sphenopalatine foramen. And so that's going to travel to the nasal cavity on the medial wall. And so going back to this, that's going to be this hole that we see here. And so what it's going to do is connect the infratemporal fossa to the nasal cavity via the Pterygopalatine fossa. We're also going to have the foramen rotundum. We saw that. That's what V2 passes through. And that's going to be located on the posterior wall back here. Also on the posterior wall, we're going to have our pterygoid canal. And we saw that with the facial nerve. It's going to be located on the posterior wall, and it's going to transmit the nerve of the pterygoid canal, which is formed by the joining of the greater petrosal and the deep petrosal nerves. We're also going to see on the anterior wall the inferior orbital fissure, which is going to connect to the orbit. So the Pterygopalatine fossa is kind of this region that's going to connect us to a lot of things. We're going to be going to the orbit, to the nasal cavity, to the infratemporal fossa, as well as some other smaller branches. And so contents, we already mentioned the maxillary artery, the third region. So we're going to give off our terminal branches. So the last 4 branches are going to come off in this region. We're also going to have V2 mostly coming off in here and giving all its branches. So we looked at V3 coming off in the infratemporal fossa. V2 is mostly going to be pterygopalatine. And so in here, it's going to give off the infraorbital and zygomatic nerves, which are going to pass anteriorly through the inferior orbital fissure. We're also going to have the greater and lesser palatine nerves, which are going to pass inferiorly down here through the greater and lesser palatine canals. So it's going to pass through the palatine canal, and there's going to be a separate opening for each of them, greater and lesser. The nasopalatine and the posterior superior lateral nasal are going to pass medially through the sphenopalatine foramen. So that's going to the nasal cavity. And that makes sense because we have nasal. And then finally, the dental plexus, and that's going to be our posterior, middle, and anterior superior alveolar nerves. They're going to pass laterally and go out the pterygomaxillary fissure. And then we're also going to have the pterygopalatine ganglion. So remember when we were looking at the facial nerve, it's going to enter the pterygopalatine fossa, where it's going to functionally be associated with the pterygopalatine ganglia. But it's structurally associated with V2. And finally, to end the video, we'll look at some clinical anatomy. So we've briefly looked at what each of these are, but we'll go into a little more depth. And so if you have deep infection of the face, then it can involve the pterygoid venous plexus. And so the pterygoid venous plexus connects with the cavernous sinus. You can see how close they are and how they have multiple connections. So they're small veins that are going to run through the foramen ovale to connect this. And it's also connecting with the anterior facial, ophthalmic, and pharyngeal veins. So all up in here. And so if you get sepsis in your nose and lips, then it can spread through all of these pathways and cause infection and thrombosis of the cavernous sinus. Next, we can look at anesthesia of the lower teeth can be attained by blocking the inferior alveolar nerve. And so the inferior alveolar nerve is going to come off here. It's going to enter the mandibular canal via the mandibular foramen. And so anesthesia can be achieved. We don't want to go too high up because then we're going to affect other branches. So you can anesthetize the person right here, and that'll lead to all of these teeth here.